My name is Aruna Pradhan. I'm a cardiologist and epidemiologist, clinical trialist at the Brigham and Women's Hospital in Boston. Prominent was a 10,000 patient randomized clinical trial, placebo-controlled, of pemafibrate 0.2 milligrams twice daily compared to placebo in patients with type 2 diabetes and mild to moderate hypertriglyceridemia. We undertook the trial over a 3.5-year median follow-up and reported in November of 2022 on the main results. And we found, despite achieving a 25% reduction in triglycerides, a 25% reduction in VLDL cholesterol, 25% reduction in remnant cholesterol, and about a 26% reduction in ApoC3, with pemafibrate, there was no benefit on macrovascular events, the primary endpoint. Well, we've had a number of studies now that have shown a lack of linkage between triglyceride lowering and cardiovascular outcomes, the macrovascular events. What we've been thinking in this community is that triglycerides are a marker of risk, but whether they're a maker of cardiovascular events, if they are actually the causal factor, remains a question. The markers that we measured in the trial, although we reduced them, remnant cholesterol, it's not clear that those are adequately capturing also the benefit that might be achieved through modulating this pathway. And so there's a lot that we have to learn, and a lot certainly that Prominent taught us we didn't know about the dyslipidemia in these patients and what confers the highest risk. As you all may know, this population had about a 10% incidence of major vascular events over a 3-year period, quite high. There are some very interesting secondary findings, secondary analyses in particular related to peripheral vascular events, to microvascular events that we've seen previously with other PPAR alpha agonists, but now in a contemporary population without the potentially adverse renal effects and interactions with statins, we may see a benefit in other important endpoints for patients with type 2 diabetes. And we are doing that analysis right now to bring that data to the public's attention. We did evaluate non-alcoholic fatty liver disease in the trial as an exploratory endpoint, and we found that over the 3-year period of exposure to pemafibrate versus placebo, that there was about a 22% reduction in investigator-reported non-alcoholic fatty liver disease. Now, those are investigator reports. They need to be validated, and we have done that. We're in the process of validating those events. And certainly from a cardiovascular outcomes trial that was purposed to look at cardiovascular outcomes, we have to be a little cautious with extending a benefit to that disease, but certainly is in line with what we think this agent may be doing in the liver in terms of fat reduction. So the take-home message for clinicians in 2023, after the trial has been completed, is that high triglyceride levels in patients with type 2 diabetes signify elevated risk. What to do with that readout, that register on the lab values, is still uncertain. We believe, I strongly believe, that addressing residual remnant cholesterol risk, the risk associated with cholesterol carried by triglycerides, is still an important factor, because after all, the LDL cholesterol in this population was quite good, and they were on maximal guideline-directed statin therapy. So there is something else that we need to pursue in this population. I would continue to measure triglyceride levels because it's quite a striking biomarker of risk. And if nothing else, at this point, diet and exercise can yield about a 5 to 10% reduction in triglycerides, which we should all be hopefully taking a minute or two to reinforce with our patients.